Okay, great. I'm going to go ahead and share my screen and just go over the agenda with you all. We have a small group today, so I'm imagining people will come in and out. But what we'd like to do, we already did our introductions, and on behalf of both NPWH and Annie, we are really glad to have you here because we are going to be talking a little bit. You know, James, I know you said you wanted to see how NAPNAP can support. You have been very supportive, and we're going to have some time for discussion about where we want to go and how the organizations can help to support one another and get this out to our members now that we know now that we know what now that we're coming back together. We had taken a break from meeting throughout the summer, and now that everybody is sort of back, we're able to do this. So what we're going to do today, we're going to have our update on air quality issues in light of all the wildfires this summer. And I just received another note from Diana Van Fleet, so she'll probably be joining us momentarily.
I'm on, Sue. Sorry about that.
Oh, there you are. Hi, thank you. Sorry about getting the timing mixed up. So I'm glad you're here, Diana. So we'll go ahead and have Diana present first, and then Kara's going to give us some environmental policy updates. And we're going to be talking about a work product that we'd like to put out in terms of a statement of including nurses with expertise in women's, children's, and maternal health on environmental and climate health related committees. And then we'll sort of wrap up with planning for our next meeting. So without any further delay, Diana, I'm going to turn this over to you. Diana is the National Director of Outreach and Engagement for the Healthy Air Campaign for the American Lung Association. And is Liz joining you?
She will be on later, and sorry again for the miscommunication on start time.
No problem at all. I will let you go ahead and get started with your slides. I guess I'll be controlling them for you. So we'll be talking a lot about not only implications, but what nurses can do to help patients stay safe and a little bit around policy issues. So Diana, I'll turn it over to you.
Great, thank you so much. I shared the slides with you. I'm happy to attempt to share my screen, but I just emailed them again to Kara too, if in case it's easier to share them from your computer.
Do you want to can you see them? I have them up.
I cannot see them on my end.
Okay, I'm going to let you share on your end. I think that'll be easier for you then.
Okay, sounds good. At this point in the pandemic, you'd think it would probably be, I would have the hang of sharing my screen by now and still reading my notes.
Oh, no. Well, while I was doing the agenda, were you all able to see the agenda?
Yes. Yep. I
Okay,
could see it.
okay, great.
Let's see. I wonder if I can still read my notes.
Do you want Kara to try?
Kara, do you have the slides? I just emailed them and I'm sorry again.
Yeah, let me, I do. Let me just download them and pull them up. 1 second.
Thank you so much. And while Kara's pulling that up, thank you so much for having me today. I really appreciate the opportunity. Thank you so much, Sue and Kara, for hosting this call and inviting the American Lung Association. I'll just start by saying, I'm the National Director of Outreach and Engagement for the American Lung Association's Healthy Air Campaign. We're here to talk about the air quality impacts and public health impacts of wildfires, which, unfortunately, we're reminded more and more of the importance of, oh my gosh, I'm so sorry, you guys. Kara, I shared the wrong presentation.
You know what? I'm going to try again.
You know what? You know what I'll do? I'm just going to go ahead and share.
Okay.
There you go. Perfect, Sue. Thank you so much. And
oh, were mine up?
yeah, that was correct. Yep.
Okay, well then I'll go back.
Thank you so much for your flexibility. Speaking
Oh,
of lung impacts, I'm actually getting over COVID and still dealing with brain fog, and I promise you it is real. And thank you to all of you for taking care of us and all your patients. And I am
It's
proof
all
that it
good.
is.
We've all been here, so
Yeah.
don't even stress about it. I think 3.5 years has taught us that we've all been in the hot seat when everything collapses. So don't stress. We got time.
Okay,
Well,
can
thank
you
you,
see
Heather.
my screen?
That brain
Cannot.
fog is real. I'm just coming out of it.
Oh, I'm sorry to hear that, Ruth.
No. It gets better is what I'm telling you.
Good.
Diana, can you see my screen?
I cannot.
Oh my gosh.
I'm sorry.
No, it's not you. We're just gonna do it
Just could
again.
though. We just could.
I know. Oh, I know what happened. Okay. Okay, bear with us, guys.
It's
So
all
sorry.
good.
No, when I shut it down, for heaven's sake.
Well, I can start off just with the
Yeah,
first.
go ahead and talk and I will get it. I will bring it up.
Perfect. Well, so just to start off by saying, climate change is a public health emergency. I'm sure all of you know this, and we are seeing climate change impact our health in real time in a number of ways. Wildfires being one of them. We're seeing longer, hotter heat waves, more unhealthy ozone days, or ground level ozone or smog, more unhealthy particle pollution, extreme wildfires, drought, storms and flooding, longer, stronger allergy seasons, spread of infectious diseases, and wildfires are part of that. You can't say that climate change caused any specific weather event, but we know that climate change is fueling more frequent and intense fires. And I will, you know what, I'll go ahead and just share it. And if I might not know all the notes, but
Diana, I've got it.
oh, you
I've got
okay?
it. I've got it. So
Well, so one specific way that we are seeing wildfires, increase in real time is through the American Lung Association's State of the Air report, which points to an increase. Okay, perfect. Okay, great. I can see it. Thank you so much.
okay.
And there you go. So we're on slide 3.
Okay.
Thank you so much. Perfect. And you just maybe click and
there.
wonderful. Yay. Thank you, Sue.
Okay. We're on.
Okay. So this is just one concrete example demonstrating how wildfires are getting worse and what we're seeing. So our State of the Air report, which comes out each year, looks at the latest quality assured data, air quality data from EPA. So this year's report looked at 2019, 2020, and 2021. We did not look at more recent data from 2022 and 2023 because it wasn't quality assured yet. But why I'm bringing this up is because you can see in this report that deadly particle pollution is on the rise, largely because of wildfires, and we're seeing it in the air quality data. And we're seeing a growing disparity between eastern and western states. And I bring this up not to say that we're only seeing air quality impacts in western states. Unfortunately, so many people across the country this year were impacted by the Canadian wildfires and the smoke. But, we really saw in this report a pretty shocking new trend that's coming up. So thanks to the Clean Air Act, a lot of the sources of pollution, power plants, vehicles are being cleaned up, which is great. But climate change is driving wildfires and droughts that are outpacing the progress that we're seeing in cleaning up air pollution. So you have this growing disparity between eastern states, which are cleaning up air pollution, and western states, which are experiencing worse air quality because of wildfires. And if you go to the next slide, I have some data to show that. So this is short-term particle pollution that shows in 2008, it was a pretty dispersed mix of grades. So the red grades represent a failing grade, red dots represent a failing grade for short-term PM or daily spikes of particulate matter. And the blue dots represent a passing grade or an A or a B for short-term PM. And you can see in 2008, it's pretty mixed. But in this year's report, you see a pretty clear distinction and pattern between blue dots on the East Coast for passing grade for air quality and red dots on the West. And that's, largely because of wildfires. So if you go to the next slide, and then the next slide. Perfect, that's it. So it's not just that we are seeing, overall, more days with bad air quality on the West Coast in areas that are impacted by wildfire, but we're also seeing the intensity really spike up. So most of you are familiar with the air quality index, indicating, code red, code orange, code yellow for air quality days. Recently, even in East Coast cities like where I am in DC and Virginia, we've been seeing more maroon and purple days, indicating that it is unhealthy for everyone to be breathing the air, not just groups and sensitive groups. So you can see in this graph just the spikes in purple and maroon days. Next slide, please. So, there are unfortunately so many examples from this year of just absolutely devastating, tragic fires in Hawaii, in Canada. And we have, in addition to just the on its face, the destruction and death that we are seeing as a result, we're also seeing a new crop of research on the public health, impacts of these fires. And so I just wanted to point your attention to two recent CDC publications that just came out, listed here, that look at some of the data in the US from the impacts from the Canadian wildfires. So if you go to the next slide, here's a specific statistic that came out of this. So CDC looked at public health data from between April 30th and August 4th of this year to analyze percentages of asthma-associated emergency department visits on days with and without wildfire smoke to estimate the extent to which the Canadian wildfire smoke led to an increase in asthma-associated emergency department visits. And so, you could see that smoke from these fires was traveling hundreds of miles. It was really, I think so many people really woke up on the East Coast to what the people on the West Coast have been experiencing for a long time. And we see in the data, or the CDC's data shows that there was a 17% higher than expected rate of emergency department visits because of asthma on the 19 days with wildfire smokes, and an 80% higher chance on the day with the highest exposure of wildfire smoke. And what this really points to is that, especially for folks who are not used to dealing with air quality related to wildfires, that clinicians can consider counseling patients about protective measures, including awareness of current and predicted air quality conditions, staying indoors, using air filtration, and using properly fitted N95 respirators when outdoors, especially with people with asthma, COPD, children, older adults, and pregnant people. So there's a really important role for clinicians here. Next slide, please. So now that we know wildfires are unfortunately getting worse by a number of measures, let's talk a little bit about the smoke, what it is and how it specifically harms health. So the composition of wildfire smoke is highly variable depending on what is in the path of the individual fire. So it can be trees and bushes, cars, homes, electronics. These can create a toxic stew of smoke, ash, and chemicals. And one of the dangerous components that is in smoke is particle pollution or particulate matter pollution, which I mentioned recently, is one of the things that we track in the State of the Air report. Next slide, please. Particle pollution which is, a very common air pollutant, can harm children and adults in a number of ways. So wheezing and coughing, shortness of breath, asthma attacks, worsening COPD, lung cancer, early death, susceptibility to infections, heart attacks and strokes. There's a growing body of evidence on impaired cognitive functioning, metabolic disorders, and preterm birth and low birth weight. Next slide, please. So everyone's health is at risk from wildfire smoke and particle pollution, including healthy adults. Especially on those code maroon and purple days, it is unhealthy for everyone. But some groups may be particularly vulnerable and susceptible to wildfire smoke, including the groups you see in front of you. And given the focus of your coalition in this group, I'll just specifically talk about children and individuals who are pregnant and their fetuses. So children face greater risks from pollution worsened by climate change. And this is because their lungs and their body's defenses are still developing, and they breathe more air per pound than adults. Because they often spend more time outdoors, kids also breathe more polluted air than adults do for their size. And in addition, children may be harmed by warmer temperatures and are at greater risk from the impact of emergency weather events and natural disasters. And then moving on to individuals who are pregnant and their fetuses, they face greater risks from climate impacts, including particle pollution. Exposure to air pollution during pregnancy can increase the risk of hypertensive disorders, including preeclampsia in the mother, and lead to intrauterine inflammation and damage to the placenta that can disrupt the growth and development of the fetus. Exposure to both particle pollution during pregnancy is strongly associated with premature birth, low birth weight, and stillbirth. These risks are amplified in pregnancies where the mother is already at a high risk, such as if the mother is a person of color or has a chronic condition, including asthma. Then moving on to the next slide. So we know wildfire smoke is really harmful. Let's talk about what we can do about it. So for individuals, how you can talk about how to protect yourself. It's always best to, as the first offense, be prepared. And it's really important to be informed. So we really encourage folks to check out airnow.gov/fires. It has an interactive map showing active wildfires and how the smoke is impacting local air quality. People can also prepare in advance by designating a clean room, if possible, in their home and having an air filtration product ready to use. It is always advised to put together an emergency kit in case of evacuation. So during a smoke event, when the air quality is impacted, it is best to stay indoors if possible with closed windows, keeping in mind that heat is also dangerous. So there's a lack of central air conditioning across much of the Mountain West and Pacific Northwest, which is something we keep in mind. So if someone has central air, they should run it on recirculate to reduce bringing in more outside air. But if they don't have central air, they should keep windows closed as much as possible. It's also great advice to ensure that you have a high quality furnace filter if you are running your system during wildfire season. If a person has to travel outside of their home or office, or they work outdoors, N95s or other types of effective masks will drastically reduce your exposure. Having said that, they don't, you're not, they don't filter out everything. But these types of masks or respirators can be difficult to breathe through if the person has a respiratory condition like COPD or asthma. So that's important to keep in mind. And then after heavy periods of smoke or an active fire, people with lung disease should avoid dust and soot and any cleanup activities, as this can resuspend the particles and they can be inhaled. For those taking part in cleanup, they should use wet cleaning methods and use appropriate masks. Lastly, on this point, I'd love to plug our lung.org page on wildfires, which has a wealth of information and resources about the many things that we're covering, especially this type of guidance with practical ways to protect your lungs from wildfire smoke. So really encourage folks to go to lung.org/wildfires. Next slide, please. So beyond guidance for individuals on the bigger picture for public health, there are a number of strategies that we can use to reduce wildfire smoke exposure. These strategies include air quality surveillance coupled with public outreach, such as spatially distributed air quality networks, providing public access to real-time air quality information, and public notification systems to inform the public and place air quality information in a public health context. So some examples of currently available networks and resources include Purple Air and the US EPA and US Forest Service Fire and Smoke Map. Another strategy includes indoor air filtration and clean air spaces. So these are key to reduce exposure. While portable air filters or HVAC systems may be implemented at a residential or household level, clean air spaces can provide public access to filtered air during smoke events. In recent years, the Western United States public spaces such as public libraries, community centers, museums, and shopping malls have been used as a publicly accessible clean air space during smoke events. Respiratory protective equipment can also provide individual protection. So you've heard enough about that. I'm happy to talk more about it later. But finally, emergency planning and response activities should include protections for vulnerable populations. This may involve notification campaigns for sensitive populations prior to and during a prescribed fire event. It is imperative that outreach efforts are connected to the community and are translated to reach members of that community and designed to reach populations that might be socially isolated, such as older adults. I wanted to touch quickly on wildfire mitigation before I hand it over to Liz to talk about advocacy opportunities. So recently, in 2022, the American Lung Association put forth a research review on prescribed fire. So, when we're looking at ways we can, we won't say prevent fire because we know fire is going to happen, period, but strategies to mitigate the harm from catastrophic wildfires. We have recently started to look at prescribed fire at the Lung Association. And sorry, you can go to the next slide, please. Existing research supports the notion that historical fire suppression policies are insufficient for longer-term fire management. And what that means really is that, putting out all fires has been shown to defer or postpone rather than mitigate air quality and health burdens associated with smoke. So prescribed burning can be a useful tool to help address increasingly urgent and dangerous wildfires if they are done correctly. And I'm happy to talk more about prescribed fire separately. I know we have more to get to, and that's not the focus of this call. There are ways to do it to help mitigate the negative air quality and health and safety impacts. But this is just this is something that we're looking at more closely as the Lung Association. And so I just wanted to touch on that. And we're not talking about agricultural burning, by the way, when we say prescribed fire.
Thank you. Any questions for Diana and Liz?
I actually have a question. Oh, go ahead, Ruth.
Well, I just have a comment air quality, as you know, is really, really important. We all breathe. There's no getting around it. And I have some EPA flags with the colors for the the air quality index. If anyone wants them, I'll send them to you, because it's an opportunity to educate people about the air quality, but it's also then an opportunity for people to then go, wait a minute, what's causing this problem, and get engaged in advocacy and policy. So if any of your agencies have a flagpole, it's an opportunity to really share the importance of air quality. And I will happily send it to you.
Riza is asking for it.
Thanks, Ruth. I just want to share it to my constituents, and they're all over the nation, including Hawaii. So I'm actually interested also, Diana, if you can share me your slides so I can give it to our chapter and regional leaders, and they can disseminate to our constituents. Very important. And you know how nurses are. they don't really have time to dig in through files. So what I do is simplistic education that catch attention, I think is the key. I like it. To me, it's a secret sauce of getting out the word out.
Just a couple of comments. First of all, Ruth put her email into the chat in case anybody wants that. We will be sending the slides out to you. And also, Diana and Liz have agreed that we could share the recording of their portion. So we will get that cleaned up and send that out. So Riza, you would have that to share with your members as well.
Thank you.
Sue, speaking of, can you stop the recording so we won't have that much to cut off?
Well, actually, I'll stop it and then I'll start it again because we want it 4 minutes.
Oh, okay. Then never mind. Just let it roll. We can cut it. It's no
Okay.
problem.
Okay. Okay. Did somebody else have a comment or
I
question?
actually
Heather?
did. And mine was more from an operationalizing this information discussion in a patient visit. And you know, being in DC, Diana, also experiencing, and I don't have comorbidities or things that would impact me, but I can tell you my throat was sore for days. You know, it was physically noticeable. My parents are in their 80s, so I'm like, of course, screaming at them to stay inside, which is like impossible, and then wear masks. And you know, my mom's like, I'll wear a mask, but I'm not staying in. But I think the thing that I see, and especially in our role as leadership that can help with education, is how do we get this into that conversation in that 10-minute visit when we're trying to cover everything, and you know, kind of broaden this. So I think that there's a whole other area in terms of how to implement that and bring it to people's attention. I think we're starting to see it personally, so it becomes more personalized. But my concern is how are we, you know, reaching the masses?
Thank you for sharing that and for that question too. I saw that Ruth shared a guide for public health professionals, which I haven't actually looked at. Thank you for sharing that, Ruth. And I'm curious to look through that. But I think it's a great question, and I think the smoke from the Canadian wildfires that are ongoing were a huge wake-up call for a lot of folks on the East Coast and in the middle of the country as well. And I think, you know, the American Lung Association received more interview requests and just questions during that time frame than ever before for anything ever. Our media shop was just absolutely inundated, and I say that just to say that I think more and more people care about this issue and have never experienced anything like it and want information on this. So hopefully, you know,
That'll
more
help.
clinicians will proactively get these questions from patients on this. But I think as much as you can, you know, as you're talking about, you know, especially if you're talking to anyone with who fits in this sensitive category, which frankly is most people, you know, pregnant people, as we're talking about women and children, you know, for sure, so many of your patients. I think, you know, just repeating myself, but one of the most important things is just being aware. So having patients know they can go to airnow.gov/fires to check it out, or download an air quality app, or even a lot of the weather apps that they use have air quality information built in. Having said that, and Heather, I can relate, it's on as a DC, Virginia person, this is really the first time I personally experienced it. I checked my weather app and it said it was okay, and it definitely wasn't. So I think, you know, just letting folks know that, you know, when in doubt, if it's best to stay inside, you know, recirculate AC, wear a mask, flag that, you know, if they have asthma or COPD, it could be difficult to breathe through the mask. There's a lot, I think there's a lot that we need to do as health professionals to educate ourselves too, and it's nuanced, and it's you know, and then also, you know, we're all learning, but I think, you know, going to lung.org/wildfires for more information too. I know I don't have all the information here, but
And we're privileged to live in an area that predominantly has air conditioning. My friends that live in Eugene, Oregon, they don't have AC.
Mhm.
And so when that big forest fire happened about 30 minutes from where they are,
totally.
they had to go and figure out, like literally research online how to make homemade filters with fans and
Yep.
wet towels and, you know, all these different so I think that's also another thing that I see. I'm not sure about nurses actually maybe providing that as a resource for folks that don't have access to you know, an air conditioned system that's circulating potentially cleaner air.
Yeah, such a good flag. And I'll just say too, you know, it to some extent is on the individual there's to some extent there are things individuals can do, but at a certain point, you know, it becomes it's a public health issue. And so I think
Totally.
having state and local governments step up and creating these clean air spaces for people who, you know, maybe don't have that option at home is really important. So there are a lot of solutions that need to happen. And Sue, it looked like you're about to say something.
Yeah, well, I'm going to try to wrap us up, but I wanted to sort of give a little bit of a closing statement. When we talked about the populations impacted and talked primarily about children and pregnant people, you know, one of the things I think providers need reminded of is that those risks during pregnancy, like preeclampsia, hypertension, asthma, continue after pregnancy. In fact, that's what's telling us that your health is now at risk for the rest of your life. And so I think that is something that's really important too, because I think when we talk with pregnant and postpartum people, they're really thinking about like, oh, okay, got through the pregnancy, baby is, you know, all of that, not realizing that I am still at risk because now I have this either chronic condition or risk for a chronic condition or risk for some type of a flare. So, you know, I think as we're thinking about our population, that's a really important point as well, that it does go across the lifespan. I'm going to wrap this up. Any final thoughts? Any final comments, Liz, Diana?
I just put in, so CDC, they do have some climate programs that they work on climate and health programs, but a lot of their wildfire work actually happens out of their National Asthma Control Program. So that program funds 26 or so states. It needs to fund more, but they have included in their priorities of just protecting asthmatics, protecting them from wildfire smoke. So they're building out additional material. They were on the ground in Maui to make sure that health was protected. So hate to be the broken record that it all comes back to funding, but it really does all come back to funding, because this National Asthma Control Program is also subject to regular appropriations. So there's, you know, to answer your questions, Heather, about, you know, like how should you best protect, like what apps should you go to monitor, like how do you create an in-person, like your own handy, you know, air filter, do it yourself air filter. Those are all questions that, for example, we've been asking EPA to take ownership over, of like having those studies so that we can get the most accurate information to the public. And they need funding to be able to do all of those. So I just wanted to add in that I was searching for a different website, but that's the one that came up, and I thought it was helpful. It just includes a bunch of different fact sheets from various sources that might be useful.
Well, thank you both
Thank
so
you.
much for joining us. I really appreciate it. Sorry about that little glitch with the timing and the slides, but thank you for being flexible as well. And we will be in touch. You know, as I said, we'll be sending the slides and recordings out. Diana and Liz, okay?
That sounds great. I'll share the PDF now of the slides. And thank you so much for having us. And yeah, apologies for the miscommunication.
Oh, no problem. And we'll also, all of those resources in the chat, we'll capture those and send them out when we send out the update for everyone. I'm going to move on. I did not want to cut this short because there was so much good information. So I wanted to, I wanted to make sure that Liz and Diana had a chance to really talk about what they're doing. Kara's going to give us an update now on the EPA information, or on the policy information. I'm sorry. So Kara, from Annie's perspective, do you want to share some policy updates?
Yes, and let me make sure I have my slides here that I could pull up. Okay, perfect. I ended up with a million tabs. So here we go. And I'll actually be able to breeze through this pretty quickly because Liz really covered a lot of what I'm going to mention. So I will just kind of share from our perspective. I'm just trying to move my icon bar that you all can't see, but it's impacting my ability to share. Okay, here we go. So as Liz mentioned, there is quite a bit of rules and regulations at EPA that we are waiting for finalization on. And this is, I know some of your groups are part of this campaign. NPWH we are as well. The Solutions for Pollution campaign is organizations that have signed on to engage in any of the important climate and energy related rules and regulations that are really important for EPA to be moving forward to help meet the climate goals that the Biden administration has put forth. And so those standards are many of the rules and regulations that Liz was mentioning around, ozone, PM, regulations for cars, coal-fired power plants, a gamut of things. And so we are tracking all these, and we'll be, right now there's not any open comment periods for EPA, but we are expecting that some rules will start to come out later this year, as well as we're looking into March of next year, in which we'll see a lot of. And this is kind of looking to the future. We also are expecting that once these rules are after they're released, will also be, particularly in the House, we'll be looking at some concern for use of the Congressional Review Act, which is a tool that can be used by Congress to repeal any standard from a federal agency that has been implemented. And they have to do that within 60 days of the standard coming out. And so we are concerned that there'll be action on those in 2024. So we'll also be a close eye on that. But just wanted to let you know that the Solutions for Pollution campaign engagement will continue. We are happy to, if your organizations don't necessarily want to join on as part of this campaign, we will still have action alerts, and you all can, pick and choose which you think is most appropriate to share with your members. I also want to let you all know, we have been closely looking at what EPA is doing around the PFAS guidance and regulations. These are the forever chemicals, what we're in the Teflon products and whatnot, and still very widespread in everyday products, but also in a lot of concern for areas that are just finding out that they've been heavily contaminated, whether due to, because they were located to industry or manufacturing, or it's military bases, airports. All of these are areas that are heavily exposed to PFAS. And so we are, watching what EPA is doing. And also, I believe it was last year, the National Academy of Sciences released their PFAS guidance, and they looked at kind of the state of the science and provided the most up-to-date guidance on how clinicians could be managing exposures, and then doing, clinical management and follow-up for those who had been exposed or had, elevated blood levels of PFAS. That document is, I think, like 400 pages. So not something that, the everyday provider is going to be reading in full. And so what we are doing is we're pulling together a clinician toolkit, which is going to kind of break down some of those most important pieces, specifically surrounding, who's at risk for exposure, what's kind of the summary of health effects, what is the testing guidance, and then kind of what is the clinical decision making tree once you get the levels back, what kind of labs are tested, how do you send out for labs, and what kind of what's the billing codes and whatnot. And then also, you know, if someone is exposed, what is or has elevated blood levels, what is the follow-up in the clinical care management. And so we will have that. It's hopefully will be released by the end of the month, if not early October. We're just in the final design stages, so we'll be sharing that with you all once it's launched. We'll also have a few webinars that we'll be holding on the toolkit. One we're going to be doing in partnership with the American Association of Occupational Health Nurses, and that registration link is on the slide. I can also share it with Sue to send out after the fact, or pop it in the chat too. We're also going to be doing some state specific webinars, and these are just in, I mean, there's a lot of states that have issues with PFAS exposure, but we're going to be targeting just a few states that have very significant. So we're looking at North Carolina and Pennsylvania, and we're also going to add in New Jersey. And so these are going to be in the fall. And we're still working on picking dates and whatnot, but I'm happy to share those registration links once we have that available. So just note more to come on this information, but we love it if you wanted to share this with members in those states, and then the occupational health nurses webinar will be applicable to you know, anyone in any state, and also they don't have to be an occupational health nurse. It's just that is who we're partnering with this on this webinar. And then the last thing I'll mention is this is an open comment period right now in which we are looking for nurses to engage on. So the National Highway Traffic and Safety Administration, they regulate fuel efficiency. EPA is the one who regulates greenhouse gas standards from cars, but these, because they affect auto manufacturers, they tend to align their standards, although they have two different rulemaking processes. So EPA, you know, just finished with their comment period for their standards around greenhouse gas emissions, and now the standards for fuel efficient cars through the National Highway Traffic and Safety Administration is now open. And where the concern is that these standards that were released were not as strong as the EPA ones released earlier this year. And since they tend to merge them together, we're concerned that this could cause EPA to pull back. And we didn't even think those standards at EPA, while they were good, they certainly weren't strong enough. And so this is a great opportunity for nurses to weigh in. There is a hearing that is going to be coming up at the end of the month. I believe folks have to register by September 22nd. If you have any members who you think would be interested, or any staff that would want to present comments at the hearing, let us know, and we can help you get signed up and help with talking points if we needed. We also would, if you're able, if you can share this link, we pulled together a commenting tool. We're actually going to be, we have a comment which folks can use as a template, and then they could adjust the comment as they'd like to add in their personalization. And then we're going to be polling these comments and submitting them directly to the docket. We're just trying to help ease the process, which we know folks are busy. So I have the bit.ly, but then also the QR code that links directly to the comment. And that is all I have for you all, but happy to answer any questions if needed. Let me just stop sharing too.
Kara, do you want to send your slides over and we can send those out as well?
Yes, I can do that.
Yeah, that way we'll have the information.
Yes, and Ruth actually put a comment too, and I wonder, Ruth, if you could talk more to that about with CDC and the clinical guidance.
Yeah, I just let Kara know that the CDC will be releasing their clinical guidance for PFAS very soon. And it's based off of the recommendations from the National Academy's report. If you can only imagine, our federal government has to go through everyone's checklist, and as soon as they think it's ready to come out, somebody else goes, oh no. So they're just a little anxious about releasing it, but the plan is it should be out in September. So hopefully.
Well, and the last thing, any other questions or comments for Kara? Okay, the last thing on our agenda was, we've been meeting for quite a while, and one of the things that keeps coming up is that there is a lack of expertise on many of the committees or in the statements that go to the EPA around maternal, child, and women's health. And we've actually had the March of Dimes speak with us a number of times about their environmental justice work group. And so one of the things that we have the opportunity to do is to develop a sort of a one-pager that builds on, they actually did a lot of the work for us in terms of their environmental justice report that just came out, in terms of what is needed for pregnant people and children. And so one of the things that I'd like to recommend for us, and since we're short on time, is that we take a look at this and develop a one-pager where we can talk about the impact on women, children's, and pregnant people's health. And, after listening to Liz, particularly when she talked about the vulnerable populations and didn't take it to the women's health level, because people tend to think about children and pregnant and not taking it forward, I think that that gives us a really good opportunity to come up with a one-pager or possibly a letter that our different organizations can utilize when we're talking with people at the EPA. We can send it to the leadership, requesting that because of these significant concerns around these special subpopulations, that each committee should have a nurse who has expertise in children's, women's, and maternal health. Does that sound like something that you all would like to work on?
Yeah, I think it will just make sense so that there will be experts in those categories that you just mentioned, especially clinicians who are at the front and taking care of these patients.
Anybody else have any thoughts? Is that something, do you think we need to do, that it would be something that your organizations would be interested in possibly signing on to?
Who is this for again? I know that March of Dimes asked for it, but who would we be speaking to?
Well, March of Dimes didn't ask for it. They just did a lot of the work for us that we can build on.
Okay.
It would be something that we are putting together,
Right.
saying that we believe that a nurse with this type of expertise needs to be included in advisory committees and so forth.
Okay. Because there is the CHEPAC, which is at EPA, which is an advisory committee for children's environmental health. They put out a lot of kind of directives or things and comment on things. So I'm just trying to not double up on work, but yeah, I mean, definitely we need the voice of nurses in all of this, because we bring reality. Medicine doesn't.
Yeah, and in that committee, Ruth, are there nurses there? I think what we're trying to say is really bring nurses now to the forefront.
Katie Huffling is on that committee. I don't know if there's any other nurse right now, Kara. Do you know? There isn't. There's only one. That's problematic.
I think so. Yeah, I can check with Katie though, but
yeah, I think you're right. I mean, I know a bunch of pediatricians on it, but and they're in transition too, so that's probably what's happened. So.
Are there any other places that should be targeted? Because again, I know March of Dimes has brought this up several times, that there hasn't been attention to maternal issues. Are there any other places? My thinking was if we had this document, it could be something that we could send to leadership in whatever places we feel need to get that message. And I would look to you guys for some of that
So
guidance.
the PACEs are reproductive and children's health. However, we can give expert opinion. We cannot, it makes me so insane. We can't advocate, we can educate. And to me, I mean, how could you divorce both of those? But
Mhm.
we're supposed to. So that's what I know exists. I don't, and I do think it's important that we have as many voices as we can, especially nursing voice.
And Ruth, can you help me understand why we cannot advocate, but we can educate? Aren't those
No,
both?
no, that's for the PACEs. That's for the pediatric environmental health specialty units, because we get money. It's so
Okay,
I don't think I'm properly American, I guess, because it doesn't make sense to me. We get money from the US government, they who funds us, so we're not allowed to advocate. But I'm like, but this is your money, so wouldn't you want us to? But anyway, that's why I'm
Yeah.
like,
it
so
could probably be because of your status as an
right,
organization.
because
Right.
I'm
And that
federally
usually,
funded. Because I'm
Right.
federally funded, I'm not allowed to, but I'm allowed to as a Villanova professor, so that's where I do.
right,
Yes, but all of us and our organizations are allowed to advocate.
You are. So
Yeah.
I'm just saying we have limited time. Let's use what exists, but then amplify it.
Right.
So yeah, I think one pagers would be good. And then to say, we're out here, we're willing to help.
Well, what I'll do before our next meeting then is maybe pull some of those talking points from March of Dimes, make a, make a statement about what nurses bring to the table and the importance of including more nurses in these initiatives and these roundtables and whatnot. And bring that, maybe send that out to you all for some comments and see if we can get the ball rolling. Okay.
And you know what a conference is coming up. It's the what is it? Medical Society of Climate and Health or something like that. And it's in I think it's in March. But they do a really, really nice job on educating people on policies. It's related to climate, educating people on policies, and then visiting with the policymakers. So it is at George Mason, I think, is that the one that's in DC? So it's typically held there, and then there's a day on the Hill, and I think they're really working to become more interdisciplinary, not just medicine, and they're working hard at it. And
George
so
Washington is in DC, George Mason's in Virginia.
okay, I
So if
think
it's the
George
DC
Mason.
one,
I always get Madison mixed up with Mason.
okay,
They're the two. So it's George Mason.
okay,
Right in Arlington or something, or Fairfax County.
Fairfax.
Yeah. So anyway, I would recommend people who want to learn more about effective policy making. It's a worthwhile conference for that, like engaging with legislators.
Do you have that information? Because we
I
can
can
certainly,
send it.
yeah, send that and we can make that available as well.
Yeah.
Okay, so we will get started on some sort of a statement. Our next meeting we're going to deviate a little bit. It will not be the first Wednesday. It will be the second Wednesday, November 8th, because we will be at NPWH's National Conference on November 1st. So our meeting will be November 8th, and Sarah Braffman is going to come and talk with us about the Pregnant Workers Fairness Act and the environmental implications of that. So, and then we can talk further about tweaking our document. Okay. Any last words anybody wants to share? Well, thank you all for being here, and we will get this information out to you all. Thank you.
Thanks, everyone. Bye.
Bye, everybody.